Yeah, and in addition to that, as you know, when you look at these cultures, when a woman becomes pregnant, the whole village, or as I would look at it, tends to have a whole way of empowering that woman and the newborn baby to be healthy. And that includes breastfeeding and things of that nature. And when you look at the development of these parts of the body, and you look at breastfeeding and the tongue moving and sucking and the cheeks and the tongue, what's the balance between the lips and the cheeks and on the outside and the tongue on the inside guides the growth and development of the jaws and the size and position of it, how deep the palate is, how shallow it is, and if the palate is broad and it's wide, then there's more room for breathing. The whole nasal area is improved. The turbinate area, the nasal sinus area, is more developed to allow for that. So I believe that's all part of the culture, and I believe Weston Price would have picked up on that too, given the incredible researcher and an individual he was.
Sure. So the bottom line is that we have large numbers of people who are challenged with this, and I know you don't particularly care for the categorization, but I would guess that the majority of the people have some type of obstructor mixed sleep apnea, and clearly, I think most people listening to this know that the common treatment for that is an instrument or a machine called the CPAP, which creates this forceful pressure that mechanically opens up the airway, but that in no way, shape, or form addresses the cause of the problem, although it may provide useful symptom relief. So I'm wondering if you can comment on that and your perspective on it.
For sure, because that's one of the points that I feel we can get to is origin of problems. And when we look at this whole situation, the majority of apnea is obstructive apnea, not central or mixed. And when you look at that, you're looking at airway. Now, the body, from my perspective, my humble perspective, is that the body functions according to the priority of CPR all the time. The body design is to keep us alive, and it's doing a great job at that. And it's functioning, and often what we call dysfunction is nothing more than the body functioning to keep us alive in a way that we find perhaps disturbing, or it maybe doesn't meet our pictures, but it's keeping us alive. So I really see this as an extension of that, and that the mouth is really the part of the body that impacts the tongue. And the tongue is the only part of the airway that's actually moving constantly. As I speak with you, as you know, my tongue is moving in and out of my throat in different ways, creating this miracle of speech. And in dental school, I remember when you made dentures, you were concerned about little shapes on the inside of the denture where in the tissue behind the front teeth to help pronunciation of speech, and how far apart the dentures were made, how wide the mouth is open, the room in the mouth, all that impacted speech. Well, I say it's impacting the tongue, and it's impacting what a person I've had the honor and privilege to study with for the last 6 years. His name is Farron Robson, who's in Tacoma, Washington. He looks at it as at the primary oral functions as swallowing, speaking, and breathing. Now, chewing is there, but primarily it's swallowing and speaking and breathing. And we've discovered that there are lots of reflexes that occur in the mouth as the tongue is moving, and affects the posture and the position of the tongue, and of course the jaw affects that, and that's affecting the airway. So, and that's affecting the airway, breathing, circulation. So that's the first priority for survival. So I feel this is a big kahuna, and you know how important breathing is, Joe.
Yeah, we can't go too long without it, or without suffering some consequences.
The benefits from learning how to breathe.
Mm-hmm.
I know that Andrew Weil even has a audio tape on breathing, and look back in history and culture, or even read the Bible and look at breath and breathing. So that baby, I think, is what the dentist is actually, like it or not, we appear to affect that a lot, because we happen to be responsible for that domain. And dentistry, as defined, talks about the teeth, the gums, the maxillofacial structures, and their impact on the rest of the body. So sleep apnea actually brought me into a point where I was able to see how what we work with is impacting it all the time. And of course, at nighttime, it shows up as sleep apnea. And we can look at how that occurs, and I'll be more than glad to move through that, because I can bring us to a way we can experience what's actually happening at night because of the way the tongue is functioning and how the body works to manage itself, as you know, the word you and I know so well in what we call homeostasis.
Sure. It's just, the interesting component here, though, is that most people with sleep apnea would rarely think to consult with a dentist to address that. They typically go to a lung doctor, a pulmonologist, to perform the sleep studies and to do the analysis to confirm and the diagnosis, and then they're off to a course of CPAP. So
yes.
I'd like you to address that at some point, because there are going to be large numbers of people who are viewing this who do have this problem, and then we need to help them identify a course that they could progress through so that they can identify a qualified, knowledgeable, competent professional who can help them really identify the cause, and then most importantly, of course, a solution.
I feel that's critical, and I will. Why don't we move into that, and then we can expand there into the whole play of the autonomic nervous system and how it affects everything you and I are so concerned about, and all the people who are listening.
Okay, let's go.
So what happens at nighttime is, of course, the body is constantly taking care of things to make it work. And I'm going to interject with some of the principles from oral systemic balance, or now called oral system biology, which are going to be very familiar to you as we go through it. But the body must compensate. If the body's compensating to keep us alive, and the literature shows this, that it explains why you see increased forward head posture in people with apnea, and it gets worse as the apnea gets worse, because forward head posture helps compensate for room behind the back of the tongue. So it's a compensation, but you and I know over time, how does it affect the rest of the body, posture in general, and how does it affect the impact on all the joints and all these knee and hip operations that aren't associated with injury? A direct injury could possibly be associated with that posture the body demands in order to manage the airway, and that's, of course, during while we're awake. But it doesn't address something that I have not seen in the literature on sleep, as to why people may toss and turn at night. The literature, in the medical literature, actually looks at how breathing could be more effective with certain people when they're sleeping on their side of their stomach. And the reason they discuss this, which is true, is that when you're relaxed, if you're sleeping on your back, gravity itself is going to help the jaw to move further backwards, and the tongue with it, and the tongue to move further into the throat and obstruct it. That makes sense, doesn't it?
Sure does.
Now, but it doesn't. That they don't explain when people are moving from side to side or moving over. It's possibly a way the body is attempting to allow more air to come into the throat. And by the way, that's something anybody here can observe that on themselves, and it's so simple.
Yeah, simple physics.
All you need to do is say hello, swallow, and notice your breathing. And most people don't feel the air going in and out of our throat. But if anybody will just do that, and then stand up and move against a wall, and have your heels touch the wall, have your butt touch the wall, make sure the back of your shoulders are touching the wall, and then the back of your head touching the wall. Everything must touch the wall. And what this is analogous to would be lying somebody on their back on the floor. And what we're doing is looking at creating a correct posture. Now, most of the time, some individuals, older individuals, won't be able to do it at all. They're so stooped over, but that's because they can't breathe if they stand straight. And others who will be able to do that will notice their head may be tipped up towards the ceiling a little bit. And then as you do that, what you do is keep your head against the wall, keep everything against the wall, move your head downward until your eyes are parallel with the horizon, and then say hello, swallow, and attempt to breathe. And you'll notice it's very difficult to sleep swallow, speak, or breathe. Yet there's never been any study doing this. It's not a complex study, but anybody seeing it can see that the postural relationship to the airway and the ease of swallowing, speaking, and breathing. And to me, if this isn't looked at primarily by every physician, including everybody looking at sleep, what are you looking at? You're not honoring that body. So a sleep physician will normally examine you, and they'll examine you while you're sleeping. And what you'll see during your sleeping is that tongue may be dropping back at different times, and it's going to show things physiologically, which you would expect it to do. You're going to and they're able to measure heart rate and different effects of that, and you can actually they'll measure movements of the jaw during sleep, what they call bruxism, when you clench your teeth together or rub your teeth against one another and grind them backwards and forwards. They see correlations there, and they'll notice how many times they'll look at your blood oxygen. They'll look at how effortful your breathing is by measuring the movement of the chest walls, and they measure stages of sleep. And from this, they'll make a diagnosis of whether you have sleep apnea or not, or to what degree you have the sleep apnea.
Well, let me just stop there. What is your impression with respect to that process? Do you believe that the person with symptoms of sleep apnea is well advised to go through that diagnostic step and have the sleep study performed for an official diagnosis, or
absolutely, yeah? Because you need if you don't measure, how are you going to know how you're doing? You need a measure.
Well, there are a number of cases in medicine where we don't do this studies, and I don't think it's appropriate either and just treat symptomatically. So I don't have the experience with sleep apnea, so I'm just wondering what as a practicing clinician, what do you find useful?
Well, first of all, as a practicing clinician, I would need to do that, and as a dentist, remember, as a dentist, I'm not licensed to treat medical conditions. However, the sleep apnea tends to be one of these areas that are allowing a dentist to treat under certain circumstances, which would mean that a sleep study is done and a physician has ordered, reads a sleep study and the diagnosis is in place. Now, different dental state boards are weighing in different ways as to what they may want. In Virginia now, they've said that you must have a referral from a physician as well as the sleep study reports, although the standard of care as set up by the medical profession and the dental profession that works with sleep apnea, specifically the Academy of Dental Sleep Medicine, states that a referral is not necessary. It's as required, because that might be in the absence of a sleep study. Because even if a patient's snoring, a dentist in treating the snoring might be putting the patient in jeopardy if you don't know whether or not they have sleep apnea, because sometimes in treating them, and it's rare, but sometimes you may stop the snoring even though the apnea persists, so the patient has a sense that everything's fine while they're at higher risk. So there are certain protocols for this, and I believe a sleep study is helpful for sure and needed.
Okay, thanks for establishing that. And what's the best way for someone who is concerned that they may have this to have a sleep study performed? And what's the process that you would recommend?
Well, I believe, first of all, the process I say is educate yourself as well as you can beforehand, because all doctors aren't the same, all dentists aren't the same, or dentists are doctors, but physicians aren't the same. This is an individual care. So you would like to find somebody whose philosophy and their approach are going to be more in tune with you. So I would, first of all, see what you can learn about these things from the beginning. Family physician may know about it. They know more and more about it because it's been promoted extensively. Back in the old days, when I was very active in this Academy of Dental Sleep Medicine, which I co-founded, I would attend the meetings at NIH once a year for sleep. The organization was one of the organizations invited to these annual meetings at the Heart, Blood, and Lung Institute, and they would look at the concern about sleep apnea and getting the word out. And they've been quite successful at this through different public media advertising and getting it into medical schools, so that the medical profession would know about it and everybody would become more and more aware of it, because they could see the correlations, the kind of how you could see the presence of sleep apnea with heart conditions. You can see with high blood pressure. You can see with diabetes. You can. They were seeing how it tracked many conditions. So it's obviously if you can resolve the sleep apnea, it's going to help